Welcome to the first episode of Bipolarcast in 2024. This is a podcast for myself and Matt Bizuki, talk to people with lived experience of bipolar disorder about their experience with metabolic therapy, such as ketogenic diet. So we're really excited to start off the new year with our friend Neseret, who got in touch and reached out last year. So I'll let Neseret introduce herself, but she is a psych nurse who has bipolar disorder and has tried using a ketogenic diet after listening to the podcast and to Metabolic Mind. She reached out to clinicians and started trying this for herself. So we're really excited about this field. This field was non-existent in metabolic psychiatry not more than a year and a half, 2 years ago. And there's some major advances happening kind of on every front at the moment for metabolic psychiatry. And one thing I want to mention is that me and Matt will be speaking at the Metabolic Health Summit this week in Florida. So we'll be speaking with Chris Palmer about metabolic psychiatry. And if you want to learn more about this, please do come to Metabolic Health Summit. And there's also virtual tickets you can get online. So please do come and see that. We'll be presenting scientific work. Matt will be presenting a story with bipolar and keto, and Chris will be doing a panel with us to talk about metabolic psychiatry. So very exciting. Neseret, thank you so much for coming on the podcast.
Thank you so much for having me. I'm really sorry that the beginning wasn't the best part, but I actually was listening to the conversations you guys were having, and I wanted to be a part of it, for trying to figure out this whole thing.
We were trying to figure out how to get a video on Neseret, so we're on the iPhone, which is working great, actually. It's very high resolution. So how did you come across Bipolarcast? And you reached out to say that you'd seen some of our interviews and you decided to try ketogenic diet after watching. What was it that made you find Bipolarcast and to try this for yourself?
Yeah, so I had been kind of trying to implement different things in the past. I worked as a psychiatric nurse for 17 years, and I worked in the adult system for 10 years. And then I also worked in the pediatric system doing emergency assessments for 6 years. And I saw that over time that medication and therapy can be very helpful for some people, and in acute crisis, they can be life-saving. But for many people, and myself included, that it wasn't helping. And so I was experimenting with different things, like intermittent fasting, just walking. I did a little bit of carnivore for a time, but that didn't work out for me. So I was just kind of searching for ways to better my mental health and find solutions for myself and for my clients. And I came across Metabolic Mind. I came across Bipolarcast. I took the metabolic therapy for clinicians from Dr. Georgia Eid. So I was just kind of in the process of just gathering information and implementing that. So yeah, and go ahead.
Fantastic. So you completed Dr. Eid's training. We spoke with Georgia on a previous episode, and she's a fantastic clinician. He has a course about this. So what made you try it for, I know you're now thinking about delivering this to other people with bipolar disorder. What was it that prompted you to try it for yourself? And what was your experience like with trying ketogenic diet for the first time?
I think personally for me, I was diagnosed with antidepressant induced bipolar disorder. And I struggled with that for 13 years. And I felt like in the end that I was almost giving up hope. And I was on a cocktail of medications. You mentioned lithium, Matt, earlier. I was on lithium, I was on mirtazapine, I was also on a birth control pill and medication for hypothyroid. And I felt that over the 13 years, my mental health declined. And I was desperate because I had an intensifying suicidal ideation as well. And this is not something that I've only experienced. I've noticed this in my clients over the years, where people are considered psychiatrically stable and they're put on a cocktail of psychiatric medications and they end up feeling just like they're in a straitjacket or chemically lobotomized. And it's not, to me, that's equivalent to being on life support. And so where's the quality of life? This is psychological life support, basically. That's how I felt. And many of my clients, I observed the same thing over the years, that, you have no energy, you're sleeping 10 to 12 hours a day, weight gain, horrific weight gain, especially on neuroleptics. And so you're just keeping your head above water. So there's a difference between trying to prevent someone from committing suicide and then having them have a certain quality of life. And so for me, I observed that in my clients, but I was also experiencing that as for myself. And in a way, it also made me question my own career and my own profession, because I was in the same boat as my clients. I didn't have much to offer to them. So I was at this place where I felt I needed to find answers and solutions. I have a young daughter, and she just turned 21. But at the time when I was really in the thick of things, she was younger. And I was also at the time midway in my career working in children's emergency and seeing all these kids that are coming in under 19 years old and their parents. And one of the major concerns was always suicidal ideation. So I was desperate to find a solution, not only for myself, but also for my clients. And so I felt that I implemented different things. Sleep. One of the things I did was give up shift work. So that was a huge deal. I got off of birth control pills, and that was another huge thing in the right direction. And eventually, when I came across this information about food, not that I was eating terribly bad before, but I just thought, well, this is interesting. I've always been interested in nutrition, and I wanted to try it. And I guess it was a whole bunch of things that added over time. But when I got on carnivore, I noticed a huge difference in just kind of my energy and my mood. But I felt my blood sugar wasn't stable. So that's when I decided I wanted to try keto. And when I did that, that was absolutely the best thing I've ever done. And it just felt the reactive hypoglycemia wasn't there anymore. And I was able to, my mood just kind of lifted. My sleep was better. My energy was great, and just everything improved. It was what allowed me over a 6 months period to taper off of all the medications.
Wow. I remember when I was on a lot of this cocktail of meds too, because I was taking lithium, I was taking a high dose of olanzapine, I was taking all these different meds. And I remember being in a treatment center. I think I gained like 40 pounds over the course of 3 months while I was at the treatment center. And I was looking at my mom's log, Ian, that it's in one of my slides for the Metabolic Health Summit deck. And it's literally me sleeping 11 hours a day, completely sedated on this amalgamation of antipsychotics, and it's just not a way to live. Like it would keep me out of mania, yes, and there's no alternative at the point because we hadn't found keto, but it's really no way to live. And yeah, it's funny you mentioned that, because I was looking at that spreadsheet my mom had, and it was like 11 hours. He slept 12 hours. He was taking these 5 medications. I guess my next question is, did you how soon after you went on the diet did you notice changes, and what was your protocol? Did you like certain foods? Were you tracking your ketones, any of that stuff?
Yes, absolutely. And to your comment about sleep, I felt like during those years I could drop anywhere, anytime, like on a street corner, and fall asleep, no problem. It was just one of those things. And that was tough because you can't be present with your kids, and work is difficult, especially being a psych nurse. It's not, you witness an incredible amount of suffering. So that being on those medications, I realized over time, even for my clients that, and for myself, that it was just a way to keep your head above water. But the sleep piece, like your productivity goes down. You you don't want to be social because you just want to sleep most of the time. So it's really makes it very difficult. So yeah.
It's a really great point that about medications. It's we've both used medications and we don't and we even advocate for people to use medications in the right circumstances. And I think that it's not recognized how the quality of life is for people with bipolar. Even with all the best medications we have available, still there's like 25 to 60% with bipolar 2 trying to commit suicide, which is, clearly that's not a successful outcome for most people, even with all the modern treatments we have available. So was there insights from being a psychiatric nurse that allowed you to see a different route to, you mentioned that you'd seen the kind of quality of life of patients. Was this part of what prompted you towards looking for another approach and another way to deal with this yourself?
Oh, absolutely. I graduated from Dalhousie University in 2006, and I went into right after that to acute care, and that is one of the local acute cares, 25-bed unit, and we saw everybody there, people with anxiety, depression, bipolar, schizophrenia, at the height of their illness. And one of my main roles as a psych nurse was to administer those medications and then to monitor pretty much 24/7. We were the eyes and ears of the psychiatrist on the unit. We're there after everybody leaves. And I remember people coming to me and telling me there's something wrong. This is not working for me. And I watched that. I monitored them closely and they told me everything. And I realized very quickly that there's no such thing as a side effect of a medication. What you're experiencing day in and day out is the full effect of that medication, all of it. And so to me, very quickly, even as a young nurse, I realized there's something amiss here. Like, this is not working for people. And it's this one size fit all approach. And some people cannot tolerate those medications. And other people, no sooner did they say, this medication needs to be stopped, then another one is being titrated. And then there is polypharmacy, where people are on several medications. And I have seen people balloon on olanzapine to like 100 pounds in 6 months. And that's just one of the medications. And so right away, I did that for 4 years. And then I was in outpatient case management. And so the ones that were considered, then now I was working with people who were considered psychiatrically stable in the community. And I was doing therapy and I was doing medication management. And I realized these people are not getting better either. And what is their quality of life? I did community mental health nursing for a bit. I was in the methadone clinic for a bit. I did day treatment. Like, I got to do a lot of different things during my career. The only thing I've practiced is psych nursing. And so I realized that so many people struggle and continue struggle and just keep their head above water. And over time, as a professional, as a clinician, you witness so much suffering and so much people just languishing in their lives. It's disheartening, and it also makes you question your path. And I love psychiatry. I love, to learn about the mind. I love what I do. I feel like it's a privilege for me to do what I do as a nurse. My grandmother did not know how to read or write her entire life. I'm originally from Ethiopia. So I don't take any of this lightly in terms of having the privilege to be a nurse. But when you see people suffering for so long with no relief, then you think, like, what are we doing here? this is not working. This is not improving their life. Like, I want to make a difference in people's lives, and I want to give them something of value and substance. And up until now, I actually, looking back in my career, I realized I believe there's 1,000 paths to healing, and we only focus on one or two. How come?
That is, I'm really glad that you say that, because certainly a lot of people can relate with bipolar to feeling like they're not thriving and their life is kind of going downhill, even when they're fully adherent to all their medications and doing well. And the quality of life can be extremely low, but we're never sure if anyone really minds about that or cares about it. So I always appreciate hearing from people who work in the field who do feel like that. I really want to ask more about that, but I also want to ask about when you were going through this transition, did you notice physical health changes as well as mental health changes? Many of us, Matt was saying, for instance, about olanzapine and how many of us have put on lots of weight. And then did you notice sort of physical health changes when you went on ketogenic diet also?
I did, yeah. So I was, to answer Matt's question too, I was being medically monitored. And so the physical changes, I gained about 15 to 20 pounds, which is not a lot but I'm a small person. So I noticed that. So that weight came off pretty quickly. That was one thing. I monitored blood pressure and
Neseret, I'm so sorry to interrupt. I think your hand might be on the microphone. It keeps going really muffled. It's quite yeah,
okay. Yeah. What about now?
That's perfect. Yes. Sorry, I didn't want to miss this bit.
Sorry about that.
Would you be able to do a repeat and I'll edit it? Just talking about physical health changes with ketogenic diet.
Yeah, so the weight came off pretty quick. That was the first thing I noticed. Like I said, it wasn't much, but that was one thing. I also noticed I was sleeping much less. I was sleeping about before 10 to 12 hours, but now probably about 6 or 7, which is nice because I have a lot more time to spend with family and to work on creative things. What else? I also, my energy was huge. The energy initially I almost thought I was going hypomanic, and I think there was a period where in that transition where you kind of, and I was also tapering off of the medications as well, so there's a lot going on. But I thought, honestly, to be completely honest, Ian, I thought I don't know what my normal is. Like, this is actually a new normal for me before or after psychiatric medications, and I really did not know what that normal was or what it feels like to just feel alive and to have energy, because I was swinging high and low for so many years. And before that, I had a very difficult kind of upbringing, sort of significant trauma, leaving a war-torn country. I lived in a refugee camp for 2 years. I ran away from home when I was 16, so I lived in a group home. But the interesting thing was that I graduated from high school with honors and a full scholarship to Dalhousie, and I was a psych nurse, and I had my daughter. Like, I accomplished a lot before I was ever diagnosed with depression. And I never considered suicide as an option, even though I've had a challenging life. I always thought life is worth living, and I want to be alive, and I like living. And once I got on, when I got diagnosed with depression and hypothyroid, they started me on the medication on the same day, which is not a proper protocol. Like, you have to treat the hypothyroid first, because hypothyroid mimics psychiatric conditions. And then within a few weeks, I became hypomanic. And I remember, even as a psych nurse and having witnessed people, in all kinds of very drastic states of consciousness, I just thought to myself, I must have been deprived like all my life, like, if this is how good you can feel. And, hypomania, it's not like a full-on manic mania. So you just kind of like, you can still function to some extent. But I just remember thinking, am I like missing something? Like, I didn't know that you can feel this great. But I realized I have experienced such just so that after that first manic episode, the next fall, I experienced my first almost catatonic suicidal depression. And I've never been suicidal before. And so to me, it was just odd that I am in this profession where we study the mind and the brain, and I'm on these medications that are supposed to help me, and my mental health is worse now over time. And I was terrified to actually get on psychiatric medications, because I knew what the impact was as a psych nurse, witnessing all my clients go through it. But this was what was presented as, oh, you have to take this. And when you're in a desperate place, you're just like, you're willing to do whatever it takes to feel better. And so it was just, I realized now looking back that once you're in that place and you feel compromised and you're desperate to make things work, you just keep trying. And I was trialed on like 10 different medications. I know, Matt, you went through that too, like, hearing your story of seeing so many clinicians and being trialed on so many different medications. And it's really hard.
Oh, it's crazy. I
No.
mean, I remember, you talk about the malpractice or the difficulty. I can think of 4 easy examples of malpractice from the medical establishment in my own treatment. From when I had my first psychotic episode, and my psychiatrist thought it was a one-off thing and took me completely off olanzapine over the course of 4 months, threw me back into college, and of course I became psychotic again. I mean, there's so many. I mean, being prescribed Ativan as a benzodiazepine and basically becoming hooked on it and having to cross taper to Valium and then do this whole taper to get off it, and having the withdrawal and having these horrific symptoms. And then there are others that are even smaller in my situation, like subtle ones that they should have picked up on, they should have known about. One was the fact that smoking cigarettes interferes with olanzapine blood levels. And so whenever I was on olanzapine and I would start smoking cigarettes again, I would become psychotic again, because there's effectively no medication in my system. But none of the doctors told us this. My mom literally had to go and figure it out for herself by doing comprehensive research about all these meds. And you go to altitude and it affects the meds. I mean, it just makes me feel like we're stumbling in the dark here, trying to figure out what to do and how to deal with these with incomplete information and treatments that don't work. And it's just impossible to live when you're on 5 meds. And my mom described it as the journey through America's mental health madness when someone goes through something like this. And that's really my experience as well.
Mm-hmm. And I think, what I love about your mom is that she didn't accept that treatment as a standard, and didn't accept the idea that, handing someone, you have a chronic lifelong disease that you can't get better off of, you can't get better from, and just this is your fate. And to me, it's just, that's not acceptable. There's so many ways to help people, so many things that could work for people. This little plant that I have here, it's a flamingo flower. It's like, sometimes they call it a Valentine flower, but it has 1,000 different species. Like, it's just a simple little plant that grows in the Caribbean and South America, and it has 1,000 different species. And I think that's the way that healing is there's 1,000 different paths to healing, not just medication and therapy alone. And those are appropriate in some situations, like I said, in acute crisis and for short-term stabilization. Psychiatric medications do great things in those, but that idea of leaving people on polypharmacy, on cocktails of medications for months and years and decades, that's not acceptable. It's not okay to treat people that way, you know? And I see that over my career, I saw that every day, where people are just tranquilized and they can barely, it's suboptimal functioning. And then the side effects of those medications, you know, your physical health is compromised. And how are you supposed to choose between having your sanity and then, or your physical health is all compromised? Like, we're not separate beings. Our spiritual, emotional, physical health as human beings, we're integrated. Our mind is not separate from our body, and our body is not separate from our spirit or our emotions. We're an integrated whole. And so how do you make a person choose between those? It's not a choice at all.
It's this so beautifully put. I was thinking about this recently because I was speaking to I had the chance to speak to the UK government about the situation with psychiatry, and this is basically similar to what I didn't put it as eloquently as you put it, but the interface between the mind and the body is they're a unified whole. This is part of a holistic system. Health is to be holistic, and we're trading the health of our young people, the physical health of our young people, for their mental health, and even their mental health is actually not that much better in a lot of cases. So it's really a suboptimal system. And I was just sharing some clips of Bipolarcast in this meeting and playing this to all these people from the government and saying this is what young people are going through, what Matt are describing, of medications not working, going through loads of different combinations, and their life can be falling to pieces at the same time. And so I think metabolic psychiatry is a shift that's happening in psychiatry out of that into something quite exciting and potentially transformative for people. And so what has it made possible for you going out of this kind of real struggle that a lot of us with bipolar go through, with polypharmacy and executive dysfunction and trying to live life, particularly when you have a child, that can be incredibly stressful? How has it changed your family life and your work life going into ketosis and using this as a treatment?
Oh my goodness, it's absolutely night and day. Honestly, it's a miracle for me because for one, it's a simple strategy. It's not complicated. Anybody can implement this. And it is based on many things. It's not just one thing. For me, it was a 7-year journey that, like I said, first getting off of birth control pills, then making sure my sleep is proper. Shift work is really tough. And then, I was starting to walk 5 to 10 kilometers every day. Then I was doing intermittent fasting. I was doing mindfulness. There was so many things that I implemented. But the thing that was, I would say, in all of my years as a psychiatric nurse, and I've worked probably about 30,000 hours, I have never come across an intervention like the ketogenic diet that is effective, that's immediate, and that has just far-reaching sort of consequences in a positive way. Yes, it was a little bit, you have to be careful. I was medically supervised by my physician and also a pharmacist, and I'm a psych nurse, so I understand these things. But so if you're going to do that, you really have to wrap yourself around a lot of support. And I also had my partner, who has been just amazing support from me and helped me every step of the way and been through thick and thin with all of this. So that was a huge thing. And so I'm grateful for all of that. And I educated myself. I spent hours, listening to you guys. I almost feel like I know you guys. I spent hours. I read Dr. Chris Palmer's book. I spent time on the metabolic mind. I did a lot of research myself. And my life now is so completely different than it has been because I can write again. Like, I love reading and writing, and I wasn't able to do it for years, for like a long time. Like, I felt like my creativity was just gone. I didn't like, I'm, I'm an introvert, and I recently started doing YouTube videos. Like, I've done them before too, but I started my YouTube channel actually in 2011. That was just a year prior after I got diagnosed, and I never did anything with it for 13 years, up until a few months ago. There's a couple of videos from a year or 2 years ago, but I've wanted to do that for a long time. I just did not have the energy. I did not have the mental capacity to just even deal with anything. I was just doing the basics of barely what I have to do to survive. And so now I started my own company, and I want to help people who are where I used to be, just barely surviving. And so I have the energy and the creativity and the passion to actually put myself out there. That wasn't me for 13 years. I am present with my daughter. I can, support her. I'm more present with my partner. And I just feel alive. Like, I feel I just felt like I was dying for so many years. Like, I wasn't even alive. That's what it felt like. I was just struggle and just surviving. I'm so sorry.
Not at all. Not at all.
It's just surviving. And now it just feels like, the conversations I'm having with different people, I get up every day excited to do the work that I want to do. Even just having a conversation with you guys, like, it's, I just feel grateful that I have my life back. And I also have now something valuable to share with people, like, that is going to help them, make a difference for them in a real way. Even, if they want to stay on medication, this still going to make a difference in their quality of life. And some people might need to stay on medication long term, but for many people, I don't think that's the case. And I also believe that now that having mental illness doesn't mean that this is a life sentence, because bipolar and remission are not used in the same sentence in this industry, and that's a very serious illness that has like life-changing, altering consequences. And I was able to help that. And that's just like, that just blows my mind, because I have seen so many people with bipolar disorder. I've taken care of them, and I couldn't say this to them before, that, hey, you're going to be okay. There's ways that you can help this, and there's ways that you can move forward and heal and thrive, not just survive, not just live with your head, just keeping your head above water. So it's changed not only my personal life. One of the things that was really important to me over those years was to be a good mother. And I have quite a bit of intergenerational trauma in my family, and I wanted to break that cycle. And for 2/3 of my daughter's life, I was half asleep, like literally and figuratively. And so that was taken away from me, and that had a tremendous impact on my daughter's mental health. And so now I am reconnecting with her and repairing that relationship. But that's what I have gotten. This is what the ketogenic diet and metabolic therapies has done for me. It's given me my life. It's allowed me to be the mother that I want to be, and the nurse that I've always wanted to be. So I could sit here and tell you for the next hour all the different benefits and what this has done for me. It's incredible.
It's so amazing. I mean, I think people might not understand how rare it is to have like a treatment or a way of approaching an illness that can do this for you. They can, what you're describing of giving you your ability to be with your children, to have your life back, to have your passion and your purpose and your career and the things that you work on back. And you're obviously someone who's really driven and like purposeful and like wants to help people and make the world a better place. And what greater thing than to have people like that being given the energy they need. I think she disappeared. I think she'll log back in a second.
Yeah, I'm not sure what happened.
That's okay. I'll do a retake on it. But yeah, that is incredible to hear your testimony and like hearing all that you've gone through from, you know, living in a refugee camp and like coming all the way to getting Dalhousie University, having a degree, becoming a psych nurse. Like it's incredible what you've achieved, even when you're unwell. So goodness knows what you're going to achieve now that you're well. That's going to be really exciting, and I hope you feel that excitement about the next stage of your life. And it's so easy to feel, and so many people with bipolar feel regret over the lost years and it's kind of trauma. And I think that's something that's great that we can talk about as a bipolar community of people, is we all have that, you know, we all have this like incredible difficulties that we've been through and things that we but we also like have this incredible future ahead when we do find a way to be well. And what an amazing testimony you have because of going through that suffering. And every great book and story ever was someone went through something really hard and brought something good out of it, you know. So that maybe that's one of the most impactful things that can happen to someone, is to go through something really, really hard like that and bring something great out of it. So I'm really excited to see what you do with it. And so I wanted to, what is your YouTube channel and the business that you're starting? Can you tell us more about those?
Sure. Just to what you just made the comment around, I heard a saying once that a person who is healthy has 1,000 dreams, and a person who's not healthy only has one, to feel better. And so I truly believe that once you have your health and your mind, then you can bring all those thousands of dreams into reality. But if you don't have your peace of mind and your health, what do you have? Doesn't matter. It doesn't matter if you have $1 billion in the bank. It doesn't mean anything because you don't have your health. You don't have your peace of mind. And I do believe that there is a reason and a purpose for everything. And I think that's part of why I'm, started this business. My business is Return to Wholeness Healing Services. And it's an educational company to raise awareness and to help others who are struggling with metabolic therapies and the ketogenic diet, and also to help them taper off medication if that's what they wish, and as they implement those things. I called my YouTube channel Confessions of a Psych Nurse, but it's in my name, just Neseret Bemient. And like I said, I'm a bit of an introvert, but I feel so passionate about this that I want to speak about it, not only because I know there's such, mental health issues and concerns are a fully blown public health issue. And just the same as the pandemic, along the same side, we also have the mental health crisis, especially with our youth. And like I said, I spent the past 7 years in working in Psych Emerge for pediatrics. And it's heartbreaking to see parents who are desperate just terrified with their kid, and the kids who are just in absolute crisis. How is it possible that the second leading cause of death for youth is suicide? These are our future generation, our leaders. Why do they come to the conclusion that their life is not worth living? What does that say about us as a society? Like, and so I've had to sit down day in and day out for the past 7 years, listening to our youth saying they don't like what they see that's going on in the world stage. They're concerned about the environment. They don't feel that they have the answers, and they're confused, thoroughly confused about everything, including nutrition. Why is nutrition not taught in schools? So to me, it's just like, we need to address these things. We need to address and find better solutions for our youth and for parents who are desperate to help their kids, but they feel just even navigating through the mental health system makes them feel insane. So I am excited to have come across this community because it's so hopeful and it's so wholesome and it's practical, and it's saying, hey, there's ways for you to feel better, and there's ways for you to move forward and create the life that you're excited to live and be healthy and happy and function, not just get by, not just be in this psychological life support, but to actually thrive. And that's a huge difference. And I feel so blessed to be a part of that, a part of the solution.
I wonder how many problems in the world we could fix if we just targeted this health wellness question. Like for me, it seems like we're all focused on the wrong things to a certain extent, where we're looking to treat the symptoms rather than the root cause. And I can speak from my own experience, which is that when I was sick and when I was having these mental health, bipolar, psychotic episodes, and even when I was like euthymic or heavily medicated, I was not like a good person, so to speak. I was dependent on my parents financially. Which is not to say I was a bad person because of that, but I was neurotic, I was paranoid, I was selfish, self-centered, self-pitying through a lot of that. So I think something that maybe we don't talk about as much, but something that's a huge part of my experience is transforming from this kind of like weak, self-centered, neurotic, self-pitying person to doing the diet, and then a result of the diet, taking accountability for my own situation. Then I was able to grow because of that. And suddenly it's been a little over 3 years since I started doing the keto diet. I started in January of 2021. And suddenly now I'm living on my own, working, taking responsibility for my own life, looking to give back, help others rather than just chase the hedonic treadmill. And my own thing. But like my point is that I think so many of the problems we have that are ostensibly related to other things, war, hatred, all of these things, like if we just, and even like you look at the political polarization in the United States, and like I just have this feeling that if we treated the health question, if we really made health and wellness a priority in society, like if this was taught in schools, um if this was a priority, if we could figure out a way to get all of these nasty carbohydrates and sugar out of the 7-Eleven and out of the stores, and like you go to 7-Eleven, it's all you see. All I see when I go in these stores is like refined carbohydrates, and this, like, now I've taken the red pill and I'm not living in the matrix anymore. I just wish we could somehow find a way to clean everything up. But again, like it's a very, very difficult task. And you were talking a lot about how, you were a psych nurse for all these years. I imagined it's changed your perspective dramatically about all of those treatments that people had and that they weren't working. And now you have this idea of what's possible, and you want to share that with everyone.
For sure. I mean, I saw, people get ECT, medication was that that one answer always, and therapy. And this is not to say that I don't have appreciation for, you know, the mental health system. It's there and it helps people to some extent, but there's more that can be done. And and there's a place for everything. You know, if you're having a heart attack, if I'm having a heart attack, take me to the nearest emergency department, and Western medicine is what's going to help me. And in psychiatry, the same thing. When somebody's in acute crisis, that is where you need to be, and there's help. But long-term solutions are different. You know, Open Dialogue in Finland, they treat, it's a program where they treat only their population with schizophrenia in acute crisis only with medication. Otherwise, they implement all other things and they integrate them into the community. And they fare so much better than the North American counterparts, where people are left on a cocktail of medications. So to me, that approach needs to be explored more. Metabolic therapies and the ketogenic diet and all the different ways that people can heal. So there's a place for everything, but psychiatric medications and that don't work for everybody, and they're not a long-term solution, and they're not sustainable. Now, what you described, when somebody is in that space, like you felt maybe you were selfish or like whatever, that's like your entire nervous system and you're kind of like a cornered animal. That's what it feels like when you're in that fight or flight mode and you're having all these medications coursing through your veins. Like you can't think further than like what you have to do for the day, and you have to just survive, and your system is so weighed down. You know, people describe it as being in a straitjacket or like being chemically lobotomized. I know those words are pretty harsh, but that is what it feels like. And so how do you even, I have to have a lot of compassion for myself during those years, even being a mother, feeling like I neglected my daughter and I wasn't there for her. Like that, I carried so much guilt and shame around that. It's heartbreaking and it's devastating, the impact of that. And so that is what is robbed of people when they're not functioning well. So you have to have compassion for yourself, because that is really deep suffering that you went through. You went through it for 5 years. And you even still to this day, you're tapering off of those medications and having to deal with the side effects and everything. Like you suffered deeply, but then your mom suffered deeply too. Like how do you account for those things? You know? So we've come a long way in many ways, but we still have a long way to go. And I feel so grateful to have come across this community, because I've always just wanted to tell my clients there's hope. And I could honestly say that now, like, yeah, there's hope. There's ways to get better for you and to move forward. It's going to be okay. You don't have to suffer for it like years and decades.
I think it's so powerful what you said about that time, and then going beyond this into I can completely relate to that feeling of just survival and just getting to the day. And that's so many people, maybe probably most people with bipolar, their day-to-day life is this survival, and they want to grow and contribute and help other people and to make their life mean something, but they just can't because they don't have the energy to do it. And I love this. I know you're a fan of Ralph Waldo Emerson Neseret. I love this quote by him. He says, we forget ourselves and our destinies and health, and the chief use of temporary sickness is to remind us of these concerns. And when you get sick, but it can also remind you of something better that you can do with your life, because you know what it's like to not have that. And so it's amazing with Matt's story, like Matt speaking at Metabolic Health Summit, the biggest like metabolic conference in the world, sharing the story with lots of people. You're starting a business to share your expertise in psych nursing and to teach people about this. And like those contributions are so massive and valuable to people in a way that wouldn't have come without that suffering. And it's such an ironic thing about bipolar. So I think it's a great aspect of this metabolic psychiatry community that people are using all that suffering to then bring something good from it, and quite powerful good things from it in ways that we couldn't have expected. So, but again, like you said, there has to be so much kindness and self-forgiveness for the time that was spent unwell, and then it's a very tricky thing for people. But so I really appreciate you coming on and sharing this, Neseret, and I'm so excited to see what you do in the future. Like I say, if you manage to achieve all that you did whilst you're unwell, goodness knows what you're going to do in the next few years. So I think it's going to be really exciting to follow your YouTube channel and your progress, and we'll post links to this, and we hope you'll come back on and speak to us again and update us on how things are going. But thank you very much for taking the time to speak to us today.
Thank you for having me. I really appreciate it, and I appreciate everything that you guys are doing to further this work and to raise awareness and to share all these stories with people. I appreciate it. Thank you.
And just to mention, the Metabolic Health Summit is this Thursday. It starts on the 25th, and me and Matt will be speaking about metabolic psychiatry at the summit. So please do come along, and we hope to see you there.
I'm massively underqualified, guys. This could be very funny. I'm with
You're going to rock
PhDs and MDs.
You're gonna absolutely rock it. It's gonna be great. I'm excited. And Chris Palmer will be there on the symposium interview, so it will be a very cool event. And there's lots of other Dom D'Agostino, of course, and lots of other amazing speakers, Walter Lungo, Tommy Woods. So I hope to see you there.